All right, today we're going to be talking about intense pulse light, or IPL. So IPL is not a laser, so it's a broad spectrum of light, so going from 400 to about roughly 900, and then with the refirm it's a little bit different, it goes up to 2000. And then what we talked about a little bit earlier today, talked about chromophores. So IPL targets 3 chromophores, water with the refirm, oxyhemoglobin, so the reds, and then melanin for the browns. So it's delivered, like I said, in kind of like a flash in a light bulb. That's how quick it is. And then it can go pretty high as far as energy. And then we use it for multiple things. So a lot of times IPL is called photorejuvenation, photofacial. But like I said, some of the things we treat, vascular pigmented lesions, we can actually treat acne with the blue light on one of the heads, rosacea, and then the skin tightening fine lines with the refirm. So this is kind of a spectral analysis of light, so going from the ultraviolet to infrared. So we have the visible light that we can actually see, so that's what we all know, and that's what the IPL fires. So from about 400 to 900 is what you see. The water actually is kind of all light together, and it's in the higher spectrum over here. I know this probably bores you guys, but it's all physics. But this kind of shows like some of the other lasers we actually have in the office, because each one corresponds to a different wavelength of light. But remember, the IPL does not work like a laser. It's not a laser, so it doesn't fire one specific wavelength. It actually fires kind of the broad spectrum. So you get a lot of value because you're not just hitting one thing, you actually get a bunch of things. But each head of the IPL is filtered, so it actually targets more of a range. So say we wanted to just cover 595 to somewhere over here in the 900s, well, we can filter off everything before that. So, and that's what they do. And then here you can actually see some of the chromophores and where they fall in the spectrum of the different wavelengths of light. So things like melanin kind of at the lower end, and then they kind of peter down a little bit as you get further up in the length of the wavelength. And then the different types of hemoglobin, they kind of go all over. And then water obviously is going to be better with a longer wavelength of light, and that's why we use upwards of 2000. And then if we actually use a laser, we use 10,600, and it's not even on the chart there, but it does a really good job. And this is actually the specifications for our machine. We use ELOS technology from Cineron, and they're actually combined with, they bought Candela, so they actually own lasers. They're a great company, been around a long time. But
I have a question here.
Yes.
So is the ST the refirm?
Yes, so this is our refirm, and this is just everything they offer. This isn't everything we have, because we use refirm.
So the refirm is from 700 to 2,000 nanometers?
Yes. But mostly, because it's targeting water, so it's at the higher end of the spectrum.
So now with the radio frequency refirm, do we have to worry about injury to the retina?
Not with the light. So you're not worried with a normal IPL. Like, it's just like if you look at a camera and it flashes, you get that bright, intense kind of effect after. So it's the same thing. We use goggles. So we have goggles that filter all the excess light, because even when it goes off on the skin, there's excess light. And a lot of our lasers, our ND-YAG lasers, the same way. There's going to be excess light that comes off. But then there's other lasers that we use, like the diode and the fractionated CO2. We don't really worry about the excess light because it doesn't flash and a spectrum that we worry about, but we always worry with any light source, direct injury to the eye. So we always want to cover the eye, and we never want to point a device at the eye if it isn't covered. So yes and no. I mean, you're always going to worry. You never really want to do anything over the eye without eye shields in or coverage, but as far as the refirm, there isn't a flash, so there isn't the risk of injury in that regard.
So you can go beyond the bony work with the refirm.
Yeah, but you always want to be careful because you can actually see in research that people have made mistakes when they've gotten too close to the eye with trying to treat certain things. So you always want to be careful.
So the refirm has light and it has radio frequency then?
Yes. Well, they all have both. They both use radio frequency and light, but refirm is mostly using radio frequency with a little bit of light, because as you can see, this energy isn't very much. I mean, it's mostly the radio frequency is doing most of the work, because you're actually treating water as your chromophore, so you really want to get that heat to the water, and that denatures the collagen, and that's the effect we're looking for, is to stimulate collagen. And then the other ones with the IPL, we're actually trying to treat melanin, so we're trying to go after the reds or the browns, so the pigmentation changes, and then vascular things. So we're trying to actually heat up the blood and to damage the vessels.
So the real difference with the SRA head that we have is that it's a lower spectrum, so it's 470 instead of 580, so that means it's getting more browns.
Yeah.
The big difference is it's better targeted browns.
Yeah, and they, what theirs is advanced. So usually that's the more aggressive one is the SRA, is what they use. And then
the big difference is just the wavelength, right?
Yeah, it's very minor. You're only talking about 110 nanometers difference. But it's hard to say too, because this is the thing about IPLs, they're not one-to-one. You can't compare an IPL machine from Cineron to an IPL machine from Palomar or Cyton or any other one, because every one of them is different in their filters. So if you see their spectral analysis of where it comes, it lights up and then it comes down, and I don't have any of those charts here, but each one is different because their filter is different. So how well they do at each range is different. So that's why even between their SR and SRA, you can see the spectrum's different, but even their filters in between there are probably a little different. And then we have the AC head. So this one, it shows, similar, even less, because with the AC, we're really trying to use that blue light to kill the bacteria. So that's why we need to go down to 400, where, ultraviolet is, and we really want that blue light. But you see it goes to 980, but it's still not doing what an SRA does. It's not really treating the reds and the browns like the other ones are. So it's mostly the blue light is what we're using with the AC head. And then we don't use their hair removal, and we don't use their skin removal.
Do you ever do the sublabate rejuvenation, or is that just talking about the SR and the SRA head?
That's actually something else that we don't have. Yeah. And then with our IPL, it has so as you can see on here, it has a cooling mechanism to it. So it actually, there's water that runs through, there's cooling plates that cool the surface of the skin. And just like a lot of our lasers, we actually put down either what's called DCD, it's cryogen, which decreases the chances of hyperpigmentation and injury to the skin. Because really you're just trying to target what's on the skin. You don't really want to treat the whole thing, because we only want to get the pigmentation. We don't want to take all their pigmentation, or we don't want to damage all of the skin. So like with the refirm, we're only trying to get the collagen. That's the only target we're trying to get at. So we're not trying to just heat up the superficial skin. So that's why it uses that longer wavelength, so it goes a little bit deeper. And then this is kind of a timeline of the development of lasers. About 1960s, the first laser came out, ruby laser, and then for the most part, that was all they had. And then in the 90s, IPL came out. They found out you could really treat a lot of things at one time, and that's why it's kind of the utility machine, because you can do a lot of things at once. And then Cineron, came up with this, let's combine radio frequency with the IPL. so we can go a little bit deeper because we're generate some heat, so things travel a little bit faster with heat. So the RF helps do that. So talked about some of the things. We don't use it for hair removal, but it can. So that's what we always warn male patients if they're going to do an IPL to their face. The beard area can be affected, usually temporarily, because we're not doing it frequently enough to actually do enough damage. And then obviously people want those freckles, those sunspots, those lenticos, they want to treat those. And we have a lot of people out here that have those, so we do a lot of the skin rejuvenation, the refirm for the skin tightening, and then the telangiectasias, the rosacea, so the redness it treats, and then less infrequently we do it with acne. So 479.80. And then it's about 1 month apart. Sometimes you can be a little bit more aggressive, 2 to 3 weeks they can come back. But for the most part, it's about once a month. People get really good results. And then it also has indications that it will reduce the pore size a little bit. Obviously, sun damage does a really good job. And then to a lesser degree with the normal IPL, SR, SRA, you can treat the fine lines. So there is a little bit of collagen stimulation. So you can see some of the results. My forehead. This one you can't really see, it's a little bright. And then on their hands. And then, so with vascular lesions, you can treat just as well. So you can see on their upper lip. And then the refirm. So with this, you usually want to do it about every 2 weeks, and they're going to need more than one treatment, and that's the thing. And just like normal IPL, you're not going to get dramatic results after one. I mean, you will see some changes, but they're not going to be blown away for the most part after just one refirm. So that's why you always got to tell them it's a series, and this goes for people who use Groupon. You're not going to get one great result, especially like if someone did laser hair on a Groupon one time. Sorry, it's not going to work. You can see your jowls. And then acne. And then this is the biggest thing too.
Acne, I want to see that twice a week.
Yeah. So this is a lot more frequent. And this is hard because it's hard to get someone in twice a week, to treat their acne.
So have you seen studies comparing the acne head versus the blue light?
No. But I'll look it up, because the thing is, it's hard because there isn't a lot of studying with the IPL blue light, whereas the blue light is the newest technology out there. So there's more and more studies with blue light, whereas this or smooth beam and some of the other stuff, people have just kind of abandoned. So either you do it or not, but there isn't like anyone leading the charge in doing new studies on stuff like this. So contraindications, and this is just for any person with a laser, so pacemaker, defibrillator, if they have a metal implant where you're working, obviously we don't want to work on anybody that's pregnant or breastfeeding, lupus, porphyria, epilepsy, and then two, since it's this time of the year where you really want to worry, if they look like they've just been tanning a lot or came back from vacation, they're not a good candidate because one of the chromophores is melanin, and unfortunately it won't differentiate the melanin that we want to actually get in their hyperpigmentation or the new stuff they just laid down. And that goes along with tanning creams. So like Mystic Tan or self-tanners will work against them too. And for the most part, most medications you can get away with, but unless they're on a few antibiotics and a few other medications, then you worry. But unless they have a real photosensitive to actually just being outside, then you probably don't need to worry too much about what they're on as far as medications. But always make sure you go over with them. And then always go over if they have had herpes in the past, any kind of light can set them off. So just making sure they're on some kind of antiviral. And then the side effects, mild temporary swelling, redness, usually lasting the rest of the day. And then they can get where they have hyperpigmentation can get actually darker for up to 7-10 days, and then it kind of crusts and flakes off. That's pretty normal. And then blistering is always a possibility, but very rare. And this is kind of our output on the machine. That's it.
And one more question.
Yeah.
What's your experience with melasma in the IPL?
Melasma is always a tricky thing to treat with anything.
Have you seen improvement? Have you had any improvement in melasma with your IPL patients?
I'm always kind of wary with treating melasma patients because you never know. You never know what it's going to do. But I've seen patients get better with IPL. But they're always the type of person you want to be on hydroquinone, probably on a retin-A. But most of the literature I've seen, about 40% efficacy that you can treat those patients. And a lot of research is being done with the 532 NdEgg to try and treat them. But yeah, they're the trickiest population out there because it's not always, melasma isn't always even pigmentation. Usually it can be deeper. It's like psoriasis, it's a lot of other skin conditions. It's like a lot of things going on at the same time. So, but